Generally, I don't prescribe this medication in kids or teenagers because it's my least favorite of all the SSRI medications. It's notorious for having a bad side effect profile, a lot of drug-drug interactions, and potential for discontinuation symptoms, all of which we'll talk about a little more further throughout this video. Welcome back, Straight Talkers. Today I'm going to talk about the medication Paxil, so that you can be more informed when deciding whether or not to start this medication. So Paxil was first approved for medical use in the United States in 1992, and by 2018 it was the 74th most commonly prescribed medication in the United States, with more than 11 million prescriptions. So Paroxetine is the generic name, and the various brand names include Paxil, Paxil CR, or Withdrawal. So how does this medication work? Paxil is considered to be a selective serotonin reuptake inhibitor, or SSRI for short. And on a basic level, it works by increasing the amount of the neurotransmitter serotonin in certain parts of the brain. In adults, Paxil is FDA approved for the treatment of major depressive disorder, obsessive compulsive disorder, panic disorder, social anxiety, generalized anxiety disorder, post-traumatic stress disorder, and premenstrual dysphoric disorder. Under the brand name Withdrawal, it's also approved for the treatment of menopausal hot flashes. It doesn't have any FDA approval for the use in kids, but it's often used off-label and can treat several other conditions, including separation anxiety disorder and premature ejaculation. So Paxil comes in tablet, controlled release, and a liquid form, and it's usually only taken once per day by most people. The typical dose range for this medication is between 20 to 60 milligrams daily, and once this medication is started, it usually takes a couple weeks before you start noticing a difference. And in many people, it'll take a whole 1 to 2 months before it reaches its full effect. Now let's talk about the potential side effects. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. So Paxil is the SSRI that is generally most well known for causing potential side effects, and it has the highest likelihood out of all of them to cause things like constipation, sedation, sexual side effects, and weight gain. Other common but more mild side effects might include nausea, headaches, dry mouth, lack of energy, dizziness, insomnia, diarrhea, sweating, tremors, decreased appetite, nervousness, or anxiety. More serious but less common side effects could include increased suicidal thoughts or actions in those under the age of 25 years old, serotonin syndrome, increased chances of bleeding, manic episodes, seizures, or low sodium levels in the blood. Paxil is the SSRI medication with the most drug-drug interactions, so you should always talk to your doctor or pharmacist before starting a new medication, and definitely make sure that your doctor has an up-to-date list of all the medications that you're taking. Research suggests that once someone's symptoms return to baseline and they're feeling back to normal, they should continue the medication at the current dose for another 6 to 12 months, and this will help prevent relapse or recurrence of symptoms. When deciding to come off of Paxil, please do not stop taking this medication without talking to your doctor first. Discontinuation symptoms tend to be the worst with Paxil compared to other antidepressant medications. And it's generally recommended that this medication be discontinued over a 4 to 12 week period in the majority of people that are on it. In some though, that's not enough time and the taper needs to take even longer. And on occasion, we'll even switch people over from Paxil to Prozac and then taper them off the Prozac instead. So some symptoms to watch out for when tapering off this medication includes trouble sleeping, nervousness, irritability, dizziness, and flu-like symptoms. Now head on over to the next video and find out more ways that you can live your best life.